Welcome to Med-Surg Tutor. In this video, we'll be talking about medication administration. Drug concepts that's important to know is pharmacokinetics. This is important because it kind of tells you how the body processes drugs. So first, there's absorption. How does the drug enter the bloodstream? Did this patient swallow a pill? Did the nurse put it through their IV? Then we have distribution. How did the drugs spread through the body? Next, we have metabolism. How are the drugs broken down? This is mostly through the liver. And excretion. How the drugs leave the body, mostly through the kidneys. Now, this is important to know because there's a lot of critical thinking skills we can apply here, such as the older adult population. As they get older, the kidney function decreases. So the excretion of the drug, might not be efficient as someone who is younger. So if you have a patient that's older and they have meds, we might want to take into consideration the dosage and how often we're giving them these meds, because we don't want it to be toxic to their bodies because they're not excreting this drug. The 7 rights of medication administration is something that every nursing student needs to know. So here we need to know the right patient. Is this the correct patient we're giving the med to? We don't want to walk into a room and give a med to a patient and it's the wrong patient. Say we give a med that's used to lower blood pressure, and the med we gave to the patient is, giving them orthostatic hypotension. Now their blood pressure is very low. This can be dangerous. Right response. So is the patient reacting the way we want them to react? So if I give a patient a medication that's supposed to slow down their heart rate, instead of their heart rate slowing, did their heart rate increase? Right medication. We need to verify the med. We need to do our three med checks. We need to make sure that this is the correct medicine for the patient. We don't want to be giving the wrong medicine to the patient. Right dose. Did you guys do the correct med calculation for the patient? Right route. So there are many ways to give medicine. We can give it IV, we can give it orally, we can give it rectally. So according to the prescription that we were given, is this the correct route for the patient? Right reason. So this is very important, knowing why we're giving the drug. For example, Tylenol can be given to bring down fever or pain management. So which one is it? Why are we giving this drug to the patient? And right documentation, making sure that we're keeping up with documenting everything that's going on when we're giving these meds. So other rights of medication administration can include right to refuse. So if the patient doesn't want to take that medicine, you can't really force them to take the medicine because they have autonomy. They have the right to choose if they want to take it. And right assessment. For certain meds, before you can give the med, you need to make sure that they meet the criteria to get that med. For example, you won't give a med to a patient if their blood pressure is too high or too low. And I got this from the California Department of Developmental Services. And I just want to reference this because some nursing courses might have different rights of med administration that they want you to know. So med routes, we need to know these. These are very important. We have orally, sublingual, and buccal. Know how to give meds each route. So with sublingual, that's going to be under the tongue, and then buccal is going to be the cheek. Now, this might confuse some people, and people might think, oh, it's just an oral med because it's going into their mouth. No, you need to be aware of which route you're giving your patient that medicine. Then we have parenteral, which is an injection. Topical, that's going to be like a cream applied to their skin. This you need to take into consideration. Are their skin clean where you're applying it? Do you need to rotate the sites? So some medications might have directions for this, but you should also apply your critical thinking skills so that you're very cautious about the routes you're using. Inhalation, rectal, ophthalmic, intranasal, kind of knowing how to give these via these routes are important. For example, eye drops. What are some considerations you need to know? You want to make sure that the eyedropper doesn't touch their eye, right? Not only because you're injuring the patient, but what if they have an infection and you just put the infection on the dropper for the eye drops? Intranasal, you need to know how to insert the medicine to make sure that their body absorbs the medicine the correct way and that the medication doesn't fall out their nose. So just review some of these med routes and some nursing considerations that's important to know. Injections. So we have three important injections: intramuscular, subcutaneous, and intradermal. I would recommend you guys remember these abbreviations because these are universal. This is how we know which route that is going. So we have the needle length and the needle gauge. The needle gauge is going to tell you the size of the hole of the needle. So a higher gauge number means the needle is thinner. And then the needle length is just telling you how long the needle is. So for IM injections, you want to use a 22 to 25 gauge. You need to know your sites. So if a patient has an order for IM injection, you know the right needle length, which is 1 to 1/2 inches, because that's how far their muscle goes in. And then you need to know the needle gauge, 22 to 25, and the sites, deltoid, vastus lateralis, and ventrogluteal. You need to know the sites because the patient might have a preferred site, and also you want to make sure you're injecting this medication into the right place so they can actually absorb it. And this kind of goes back to pharmacokinetics. Then you have subcutaneous. Subcutaneous is the fatty layer. So here it's not as deep, 3/8 to 5/8 inches. You're going to need a needle gauge of maybe 25 to 27, and the sites are going to be the abdomen, thigh, back of upper arm. These are the more fatty places of the body. So insulin is typically given here with your patients. You would want to know what their preferred site is. If the site is red, swelling, you might want to rotate sites. Intradermal. Intradermal, this is going to be 3/8 inches. We don't really use this route too much, but you can use the forearm. We typically do this for TB testing or allergy testing. And I will also go back and practice these skills so you know what angle to give these injections at. So some of the key points that I recommend people know when they're studying for medication administration is know the interventions for certain drugs. For example, when giving insulin, you want to bring a snack just in case that their blood sugar levels are too low. You want to be able to bring that back up by giving them, some food to bring that blood sugar back up. You want to prioritize safety, right? Remember those seven rights of medication administration. Remember to check your medication calculation, right? And then know the procedures for giving meds. You have intranasal and you have oral. You need to know if they need some water, like if they need water for those PO meds, bring them some water so they could swallow that med. You need to know how to insert eye drops. That's always good to know. And know the abbreviations. These are very important to know. And then know the different considerations like central and peripheral lines. So with central lines, you are always going to aspirate back some blood. But with peripheral lines, it's okay if you don't aspirate blood. But to test if the line is not occluded, you can always do an IV push to make sure that the line is patent. And I will go back and review that. And be mindful of your pediatrics, geriatrics, and pregnant patients. What meds can't pregnant women get? And remember when we were talking about that pharmacokinetics, the geriatrics, right? Their kidney function may be lower, so that excretion may be impacted. So you don't want to give the meds back to back. You want to be mindful of, the schedule that they're getting meds because it can stay in their bloodstream longer and be negative to them. And be mindful of those pediatric patients. Around the whole lifespan is very important. But most of all, use your critical thinking skills. Use the knowledge that you learned in class to think it through when you're giving medication. Now I want to go over some safety. So med checks, allergies, let's talk about it. Is the patient allergic to the med? Before you give the med, you have to read the chart, see if they're allergic to anything, and even ask the patient. Who best to ask than the patient, right? You don't want to give them a med that they're allergic to. Like say for instance, penicillin, right? You want to check their chart. And if it says they're allergic to penicillin, you want to reach out to the healthcare provider. Did you use your patient identifiers? Is this the right patient? Did you check their ID band? I remember a door number is not a patient identifier. You typically want to use their full name and date of birth. Can the patient swallow the med? Does this patient need assistance? Does this patient need help with swallowing the med? If so, you can reach out to the healthcare provider and see if there's another route that you can get for the patient. And this goes into do not crush certain meds. Why? So some meds are enteric coated so that they're not destroyed by the acid in our stomach, because if the acid in the stomach destroys the medication, then it has no effect on the patient. So this is why they're enteric coated, because that outer coating is going to protect the medication inside of the capsule, right? So you don't want to crush these meds. Do not recap needles. Why would you not want to do that? Say you're giving your patient a vaccine of some sort and you recap the needle and miss the cap and accidentally hit yourself. And this patient has something like jaundice. This disease, jaundice, can be transmitted to the nurse. So we kind of do this as a safety measure. So not only do you have to be safe with your patient, you have to be safe with yourself. So never recap those needles. Most of all, hand hygiene. When you're checking those dressings, when you're giving meds, always wear your gloves, always perform hand hygiene. Especially on those exams, they emphasize hand hygiene and safety. So out of every slide in this video, this is probably the most important. Check off high alert drugs. So for those drugs that are high alert, like controlled substances, you need to get a nurse to check off on that. You need to make sure that whatever extra medication is disregarded according to the way the hospital requests. And also insulin. Insulin is very important to get checked off. So say for instance, you have a prescription to give, an order to give the patient some insulin, but you accidentally draw up more insulin than you need. You can hurt this patient by doing that because one, it's not right dose, and two, because you can drop their blood sugar way too low. So always get another nurse to check off on it to make sure you have that correct dose. And then you want to monitor the site. So swelling and blockage, monitor for allergic reactions. Say you give a med to a patient, you always want to kind of stick by and see that they're not having any adverse effects to that medication. Some more safety things: monitor labs for certain drugs like insulin, opioids, heparin, monitor those PTs, monitor their respiratory rates with opioids. So say for instance, you give them an opioid and their body reacts in a way that their respiratory rate is like at 8 or 6, you want to instantly give them some Narcan because that's a drug overdose. Avoid errors. So verify those calculations. Do all you can to make sure that you're following the 7 rights of medication administration. And confirm drug interactions. I gave an example here. Giving a patient vitamin K rich food after giving them warfarin can negate the impact that warfarin was supposed to have on them, because that that is basically the antidote to warfarin. So if you're giving them the antidote to the medication, you got to be careful with that. So make sure you're checking the interactions and encourage adherence. So with antibiotics, you want to make sure they're sticking to their set schedule for those antibiotics, that they're not sharing their antibiotics with anyone, even if they start feeling better, because we don't want any superbugs. And that's how superbugs start, because people are not finishing their medications, especially with antibiotics. And then another note here, I want to mention is that you wouldn't give an antibiotic for a viral infection. So if you guys see that noted in your patient's chart, always reach out to the healthcare provider in case they made a mistake. And they also might try to trip you up on exams that way. You never give antibiotics with antivirals. You want to give antivirals for viruses. Educate. So know what you're giving your patient and know the right reason why you're giving it to them. So I gave that Tylenol incident. You may be giving it to them for a fever, but you told them you were giving it to them for pain. So your patient might know, hey, they're giving me Tylenol. I usually take Tylenol when I'm in pain, but they don't know that Tylenol is actually an antipyretic as well. So educate your patients about that. And last but not least, monitor for side effects and adverse effects. This is so important because as soon as those side effects and adverse effects happen, we want to jump on them. All right, guys, this was the last slide. I will be coming out with some practice questions. Happy studying.